Welcome to today's educational video where we'll be diving into the world of esophageal spasms. Often misunderstood, this condition can significantly impact a person's quality of life. We'll explore its causes, symptoms, diagnosis, and management to give you a comprehensive understanding of this fascinating, yet challenging disorder. So, what causes these disruptive spasms? The exact etiology of esophageal spasms remains somewhat of a mystery, but several factors are believed to play a role. These include dysfunction of the nerves that control the esophageal muscles, imbalance in neurotransmitters, acid reflux, anxiety or depression, and even exposure to extremely hot or cold foods and beverages. It's often a combination of these elements that leads to the development of esophageal spasms. To understand esophageal spasms, we need to look at the pathophysiology, how the condition actually works. Normally, the esophagus contracts in a coordinated, wave-like motion called peristalsis to push food down to the stomach. In esophageal spasms, these contractions become irregular, uncoordinated, and sometimes intensely strong. This disrupts the normal passage of food and liquid, leading to the characteristic symptoms we'll discuss later. These spasms can occur spontaneously or be triggered by swallowing. Scientists believe this abnormal muscle activity stems from problems with the nerves that control the muscles of the esophagus. Sometimes the lower esophageal sphincter, the valve separating the esophagus and stomach, may not relax properly, adding to the problem. Determining the precise epidemiology of esophageal spasms is tricky. Many individuals may experience mild, infrequent episodes that go unreported or are misdiagnosed. However, it's believed that the condition is relatively uncommon. Esophageal spasms tend to be more prevalent in middle-aged and older adults, with some studies suggesting a slight increase in incidence with advancing age. There is no significant difference in prevalence between men and women. While not considered a widespread condition, esophageal spasms can have a significant impact on those affected. Now, let's talk about what you might experience if you have esophageal spasms. The primary symptoms are chest pain and difficulty swallowing, also known as dysphagia. The chest pain can be intense and feel similar to angina, the chest pain associated with heart disease. This can sometimes lead to unnecessary anxiety and ER visits. The dysphagia can be intermittent, making it difficult to swallow solids, liquids, or both. Some individuals might also experience a sensation of food being stuck in their throat, heartburn, or even regurgitation. It's important to note that the severity and frequency of symptoms can vary greatly from person to person. Diagnosing esophageal spasms involves a series of tests to rule out other conditions and confirm the esophageal dysfunction. A common initial step is an upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus to visualize the lining and rule out structural abnormalities. Esophageal manometry is a crucial test. This measures the pressure and pattern of muscle contractions in the esophagus during swallowing. It can help identify the characteristic uncoordinated and forceful contractions associated with esophageal spasms. A barium swallow, where you drink a barium solution, is another test which allows X-ray imaging to visualize the esophagus and identify any abnormalities in its shape or function. Acid reflux testing may also be performed to see if it's contributing to the spasms. Esophageal spasms can be categorized into different types, although this distinction is often used more for research than for direct clinical decision-making. Diffuse esophageal spasm, or DES, is characterized by uncoordinated and often forceful contractions throughout the esophagus. Jackhammer esophagus, also known as hypercontractile esophagus, involves extremely strong and prolonged contractions. Sometimes the diagnostic picture isn't clear, cut, and patients may have features of both of these conditions or not fit neatly into either category. These classifications help physicians understand the specific nature of the esophageal dysfunction. Managing esophageal spasms typically involves a combination of lifestyle modifications, medications, and in some cases, more invasive procedures. Lifestyle changes can include avoiding trigger foods and beverages, eating smaller, more frequent meals, and managing stress and anxiety. Medications often used include proton pump inhibitors, PIs to reduce stomach acid, calcium channel blockers and nitrates to relax esophageal muscles, and antidepressants to address underlying mood disorders that may be contributing to the spasms. In severe cases, botulinum toxin and Botox injections into the esophageal sphincter can help relax the muscles. Rarely, a surgical procedure called a Heller myotomy, which involves cutting the muscles of the lower esophagus, may be considered if other treatments are ineffective. Unfortunately, there's no guaranteed way to prevent esophageal spasms, given that the exact cause is often unknown. However, some steps may help reduce the frequency or severity of symptoms. Identifying and avoiding trigger foods and beverages is crucial. Managing stress and anxiety through techniques like meditation, yoga, or therapy can be beneficial. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, may also play a role in overall esophageal health. If acid reflux is a contributing factor, taking steps to manage it, such as avoiding lying down after meals and elevating the head of your bed, can be helpful. The prognosis for individuals with esophageal spasms varies depending on the severity of their symptoms and their response to treatment. Many people can effectively manage their condition with lifestyle modifications and medications, allowing them to live relatively normal lives. In some cases, symptoms may be persistent and require ongoing management. While esophageal spasms are generally not life-threatening, they can significantly impact quality of life due to pain and difficulty swallowing. Recent research is focusing on identifying the specific nerve and muscle abnormalities that cause esophageal spasms, with the hope of developing more targeted and effective therapies in the future. Studies are also exploring the potential role alternative therapies, such as acupuncture and biofeedback, in managing symptoms.